So today we have three panelists. These panelists, we have included some women from the community, some professionals, entrepreneurs, researchers, and activists. And so this session is full of tips, tool tips, tricks, and resources for all of you. So welcome again to CWC, or Crack the Wellness Course, Menopause Journey and Holistic Health.
Thanks, CWC, for inviting me and sharing my opinion and my experiences with everyone. As you know, I've been practicing OB/GYN for a while, so I just want to go back on. Let's start with the main topic right now. I'm supposed to talk about menopause. Now, the average age of menopause is 52. Second, what are the symptoms of menopause? Is vaginal dryness, hot flashes, sleep disturbances, mood swings, vaginal irritation, dryness, a burning sensation, and sometimes urogenital symptoms too, like you have difficulty urinating. These are also symptoms that could occur in menopause. What is menopause? If you don't get your periods for 1 year, that is menopause. The period while you're having like 6 months, 9 months, and then eventually you don't get your period for 1 year. So the period surrounding menopause is perimenopause, and you might get symptoms of the symptom that I mentioned even in perimenopause. The only reason typically we treat patients is for two symptoms, which is pretty prevalent, is 50 to 60, 82% of patients, of women, they have breast hot flashes and vaginal dryness. Now, the goal of treatment is basically small dose for a small amount of time. And that's the main goal of how we look at treating menopause symptoms. Now, there are two types of treatment, and I am always for, if you could avoid hormones, extra hormone, that's great. Go for walks, go for meditation, and I'm sure we're going to talk about that after my session. Yoga, wellness, food items that might help in relieving menopause symptoms. So I'll talk about the medical treatment, and still I say small amount of dose for a small period of time. That's very, very important. Now, there are two types of hormonal treatment. One is non-hormonal. Non-hormonal in the sense of lubricants, vaginal creams, vaginal suppositories like vitamin E, vitamin D suppositories. You also get, these are medication non-hormonal treatment that could relieve symptoms. Sometimes I tell patients you can try little soya products also, orally soya product that might relieve your symptoms of menopause.
How does typically a woman know that she is in perimenopause? Because there can be symptoms that are similar to maybe some other issues or maybe menstrual issues. So how does a woman know that she's in perimenopause?
So one is that if she gets a period like every 3 months and then 6 months, so it's kind of waning away, and then that is perimenopause. Yes, we can do some blood work also, which can tell us it's a serum FSH. We can do that as well, which if it is more than 30, 35, it's typical menopause. She could still be having her periods, but at the same time, if the serum FSH is elevated, it could indicate she is perimenopause.
Is it just the irregularity, or could there be other symptoms?
There could be hot flashes. So even though she's not menopause, she could have in perimenopause hot flashes, mood disturbances, sleep disturbances, vaginal dryness.
Okay. So now you mentioned that a typical age is like 52 and perimenopause begins early on. So how early does it begin?
Sometimes it's about a year, 2 years. So that's about 2 to 3 years, even before you finally reach menopause, you could have these little symptoms occurring slowly.
Okay. So please go ahead. Cover the rest of the things.
So the hormonal treatment would be two types. One is estrogen and progesterone combinations, and the other one is only estrogen. Estrogen, again, the hormonal HRT increases the risk of, now patients ask me, what are the risks of taking this? Yes. One is increased risk of thromboembolism, that is clots. That is pretty incidence of that is about, I would say it increases with age, as well as it increases with about 1.2 to 1.5 fold increase uh, compared to non-users, the incidence of clots or thromboembolism. Again, if the patient has got morbidity, like increased risk factors, obesity, fracture, immobilization, they might have thrombophilia genes, that is factor V Leiden. There's certain tests that we can do to see are they at risk of having a stroke or thromboembolism. So these are the patients you would want to avoid hormone replacement therapy.
So,
So
question there is, I mean, at what stage or that a HRT or a hormone replacement therapy is suggested? What are those
it's
cases
it's
when somebody
necessary.
needs it? Yeah.
Yeah. Say if hot flash, a lot of people don't have any of these symptoms. They're fine. They literally thrive through menopause without any concerns.
Mm.
But if these symptoms are causing difficulty in your daily living,
Mhm.
like you get up about 6, 7 times at night, hot flashes, you're not able to concentrate, you're not able to sleep, then and vaginal dryness. So two main indications are vasomotor symptoms, hot flash and vaginal dryness. If these are the two things that's really affecting your daily life,
Mhm.
yes, go ahead and take it.
At what point do you assess that, yes, this is very difficult for a certain woman to kind of deal with and maybe suggest HRT? Or are there other ways to kind of convince not to go for HRT, but there are other mechanisms to deal with it?
Right. So that's what I say go ahead and try like food items like soya, and I'm sure they're going to go through on the herbal treatment. There's so many herbal treatment that's available out there, which I think they'll follow up with a talk after me. Meditation, um, exercise, excellent. I always prefer that patient do all of these before meditation, running, jogging, exercise, open air, you know, diet modification. So if this doesn't work,
Mhm.
then I would say then I would recommend hormone replacement.
Okay. So, I mean, menopause or perimenopause is a phase of life, and a
Yeah.
lot of women kind of struggle or get depressed or feel that, oh, I am now at a juncture where it's a downhill. So, how do doctors or like doctor like you kind of help deal that? Because a lot of women feel that I have menopause issue, and I feel that it's not an issue; it's kind of stage of your life, and every woman has to go through it. So how do you address that with any patient that comes to you?
So I typically say yes. Is it affecting your daily life? And if it is, then go ahead and do the non-hormonal treatment, as I mentioned. And if you still want to go ahead and take hormone treatment, then I would recommend, you know, the hormone HRT. So
Mhm.
I leave it to them to decide about how are they able to cope
Mhm.
with hot flashes. Some of them say, yeah, we just get it once in a while. And I'm like, okay, you don't need it. You don't
Mhm.
need hormone replacement therapy. And I'm able to do my daily work. Then I wouldn't recommend hormone replacement. We don't want to give patients hormone replacement if not necessary, remember.
Right. Right. With this phase, the hormones are kind of depleting. They are on the downhill or downside. What are the things that a woman has to watch out for in terms of health? Is there any supplements that they have to continue, or does the body automatically kind of deal with it?
Well, yes. Usually the body automatically deals with it because the peak of these menopause symptoms is really a year after your last period. That's when it peaks and it slowly subsides over the next few years. So by the time they're 57, 58, they typically may not even need any hormone. They might not have any symptoms. So in that case, I say multivitamin, vitamin E, vitamin D. These really help in and help relieving the symptoms.
So we generally hear that the bones become weak, there is a chance of breakage or fracture.
Of course.
So why does that happen? I
That is
mean,
because the estrogen level is so low, these chances of the patient of the bone loss that causes bone loss, bone osteopenia, that is decreased density, and then eventually bone loss. So
Mhm.
we always encourage them for weight-bearing exercises, vitamin D supplements, calcium supplements, very, very important. Once you reach you're in perimenopause state, we'd recommend starting it. And then there's also a DEXA scan that we do at 65 to see how much is the bone loss.
Mhm.
Vitamin D levels, which typically we do it at all annual examinations, is another important thing to check.
Mhm.
Yeah.
Good to know. Okay. What else should we kind of
So I think those are the main thing. Now there are hormones, I would say. The different types of hormonal medications also we have, they're called as the bioidentical hormone. Now remember, there's bioidentical hormones and there are compounded bioidentical hormones. Bioidentical hormones are the ones that we can, is available now in terms of estrogen and estrogen testosterone progesterone combination and testosterone as well. So these are the forms that it can come in the form of gels, in the form of sprays, vaginal inserts, and these are all FDA approved
mhm.
biodegradable. So the other one is a compounded. A lot of information out there about compounded that is made by the pharmacist. It's typically like, and that is not yet FDA approved as far as I know. But a lot of these compounded identical hormones, bioidentical hormones are made by the pharmacist. So say if a patient, and we would say only if a patient has an allergy, say a peanut allergy, and your bioidentical hormone has a peanut, they use these as mediums for the gels, etc., then we could say, okay, well, maybe have it compounded to a certain method so that to avoid the peanuts in that uh, prescription, in that medication. So they have pellets, they have compounded bioidentical, which we don't recommend that because it's not FDA approved
Mhm.
at this point. There's lots of information out there. It's just coming up, but the safety and efficacy is not known. Simply because you really can't control the amount of hormones going into the body.
Mhm.
They have injectable pellets, vaginal inserts as well.
For example, menopause leads to weak bones, and we know that there are some supplements that you talked about. But there are other things that also impact a woman, like hair loss, maybe
Mhm,
mood swings, depression.
mhm.
So, have you seen more and more South Asian women coming, or in your medical practice? I'm sure you are also dealing with non-South Asian women. Have you seen any difference in how one segment deals with versus the other?
No, I think it's across the board. Everyone is having these symptoms, hair loss, mood symptoms, sleep disturbances, the estrogen when it goes down. Now, again, I tell them, please check your thyroid levels. Please check, these are the main, one of the causes. Nutrition is, of course, very important, and thyroid levels to reduce if there's any evidence of thyroid abnormalities, you need to correct that for hair loss.
Mhm.
So yes, a lot of people do have this. And well, estrogen may or may not, hormone replacement therapy is not indicated for treatment of hair loss. So that's a normal aging process. HRT is not one of the indications. For hair loss is not one of the indications for that. Yeah.
Have you seen cases where I mean, a woman is it's very difficult for her to deal with it, and on the other side, also the family probably doesn't know why somebody's having mood swings or going through a certain phase.
Yeah.
Have you uh, had to advise anything to the family, or is it just to the woman how to deal with it? Just I'm interested in knowing how family plays a part in this.
Well, so hair loss, okay. Could it be just hormonal? Could it be thyroid? Could it be water, change in shampoo, change stress? Of
Mhm.
course, stress. So stress is a factor too. And I always counsel them along with the family to say, if there's any evidence, you want to just deal with that first as well. Stress, bad food habits,
Mhm.
nutrition is very important. That those are main basic things that we need to check on. Um, and yeah, I do counsel them on that. That's definitely important. It's a holistic approach, right? Yes.
Correct, correct.
Yeah.
So, any other advice for the women? How to deal? Any tips, tricks? You talked about HRT. You talked about the symptoms. from perimenopause to menopause. It can be 1 year, 2 years. For some people, it might be longer. And also, in many cases, we won't know whether we are really in perimenopause or is it something else. So I'm sure that when the woman goes to a doctor, there are various things that you check to ensure that yes, it is perimenopause versus some other chronic illness. Anything that you would advise the panelist, the attendees on this call, or anybody who's going to watch this interview in future?
Right. So sometimes, you do have cases where it's premature ovarian failure. That means the ovaries has kind of failed before really 52. And so those are the cases that we can always kind of check on the blood work and make sure that have they reached premature ovarian failure. And those are the ladies who might have, early menopause symptoms, like in late 30s, early 40s. And so those are the blood work that we can do to confirm it. So whenever they go in for the annual exam, there are blood tests that we can do just to see whether they do fall in the category of one, premature ovarian failure, and second is perimenopause. So this is something the patient should definitely, women should address with their with their GYN about these symptoms when they have it.
Got it. Monisha Bhatia, she's asking, I'm having a lot of sleep disturbances for falling asleep, and I'm sometimes hot and sometimes cold. I had UFE procedure 2 years ago and the procedure went fine. Does a woman still go through the menopause symptoms, which I'm assuming we all do, but it is still a puzzle at times? And any solution on this? My periods have stopped after the procedure complete.
So age is a very important factor. I mean, to the age. Okay. So yeah, 53.
Yes.
Okay, so that she reached the menopause now. So she needs to basically, sleep disorders is the main thing. A little bit of estrogen. And what is the treatment that she went through? I missed that.
UFE procedure.
Okay. So she could take a little bit, a little hormone always. Now, vaginal and gels, like spray or gels, are always better, and they help in relieving symptoms. But not the oral. The oral estrogen goes through the first pass through the liver, and there are increased chances of thromboembolism. So patients are better off taking vaginal gels or vaginal creams or gel applications.
Okay.
That will help her. And sometimes, if you don't want to take hormone, then you can take like Ambien, something to sleep. That's non-hormonal also, so that might work for her.
Okay. You touched upon the typical age, but then you also said premature menopause, right? How early have you seen any woman going through premature menopause, and what should she be aware of in terms of taking care of her health?
Yeah, typically I've seen that it could be a genetic thing that is, if premature menopause, their mom could have had it, their sister could have had it, it's kind of genetically. Again, these are the patients who really want to make sure that they have the vitamin D levels, calcium, because now they're going to have early bone loss, right? Because it's so earlier on in age. So bone weight-bearing exercises, vitamin D, calcium, these are very, very important things for these patients to take. And if they do get symptoms, again, they could go ahead and take a hormone replacement therapy.
So is it typically recommended HRT if somebody is in menopause in their mid-30s?
No, not at all. Not unless they have symptoms.
Okay.
Not at all. And even if they have symptoms, go with a non-hormonal method, please. First is that. And then if that doesn't work, then you go on to. And I've seen that these patients, that sometimes they don't even have symptoms of menopause, the premature menopause. They're fine. They have, except cessation of periods, they have no hot flashes, no vaginal dryness. They're good. They're all okay. But then I encourage them to take the vitamin D, very, very important, and calcium.
So another question says, Western women take HRT very liberally for years. Why the hesitation to prescribe it? What are the side effects?
They've been taking it for years? Is that what it's saying?
The question says, Western women take HRT very liberally for years.
Well, they are also to be monitored very carefully. So if you remember I said in the beginning, small dose for a small period of time. But if you're taking it for a while, you should basically have checked your ultrasound, uterine lining, make sure if you have any bleeding to have an endometrial biopsy done. Unopposed estrogen could cause increased chances of endometrial cancer. So that is why we gave an estrogen progesterone combination so that there's an add back therapy.
Mm.
So the we have these patients need to be closely followed because you really don't want to take it for a long period of time. Once you'd have, so what I do is I say, okay, take the medications, but like take it twice a week, twice or thrice a week. See if your symptoms go away. If they do, great. Then taper it off, and see whether you can do it just once a day. Great. Once a week, if you can do it, you don't, then you can take once a week, maybe for 6 months, and then see how you do. So basically, small dose, small amount of time, and then taper it.
Okay.
They don't recommend long-term SERT, estrogen hormone replacement therapy. But you have to be followed by ultrasounds, endometrial biopsy, make that very, very important.
Okay. And maybe a couple of final
Yeah,
questions
yeah.
is over-the-counter calcium and vitamin D sufficient, or is it prescription grade?
That is sufficient, depends on the vitamin D level. So if you do every year, you do a vitamin D level and make sure it is in the optimum range, you can take that. You can take injectable vitamin Ds too if your vitamin D is very low.
Mhm.
So it all depends on the level. And all women, 60 years, they should get a DEXA scan done, bone scan, just
Yeah.
tell you what are you moving towards bone loss? Or are you, so that's going to give you some more information.
So when you say you should get these scans done, does the doctor typically mention or prescribe it, or should a woman be aware and ask for it?
You should be aware because it's a screening test. It's a screening test done when you come in after 60 to your well woman exam.
Mhm. Okay. But I'm assuming it is part of the well women exam that these would be recommended by the doctors.
Yes.
Okay.
I mean, this is a vast topic. And so there are a lot of things like, what do you do in a patient with breast cancer, hormonal replacement therapy, with the almost about 30, I think the number of people with breast cancer survivors is almost about 3.8 million at this point in the US. So that's a whole different topic about estrogen hormone replacement in breast cancer survivors, patients with family history of breast cancer. That's going to be maybe a different day, a topic, and we can discuss. So that's also a lot of questions are asked on those as well. But I think overall on this, I would say non-hormonal is the best. Yoga, exercise, and all of that, diet. And if still you don't have any symptom relief, then consider hormone replacement therapy.
So I'm just going to start with my personal journey, as Yashri talked a little bit. So my name is Amita Sharma. I'm co-founder of Nourish Doc. So I started this journey in 40s, and when I was sitting in the meeting, like talking to other engineers, and I started sweating. I never sweat in my life. I'm like, suddenly I'm sweating, like seriously, the water's coming down on me, and everybody's looking at me. I'm thinking like some people thought that I'm having a panic attack. And then it wasn't like one instant. I again started having the similar things, different times of the day, different meetings, all that stuff. I was like, oh my God. I started researching, and guess what? I was in perimenopause. I did not even know the word perimenopause. What the heck is that? I am like, oh my God, I'm getting old. I'm like, all those feelings, right? Then I started looking at it and then realized there are three stages of menopause, right? First is, of course, premenopause. We are all young. Then the perimenopause, then the menopause, and then the postmenopause. I'm like, oh my God. Then all these things that I've written here, fall into your perimenopause, right? The symptoms also change based on your stage of wherever you're going. So as Dr. Nirva talked about, last period, 12 months, you go in menopause. Then technically, menopause is your birthday, right? One day is menopause, then you are in postmenopause. She talked about all the other issues related to osteoporosis, heart disease, all those things. So what? I looked at the 7 stages of menopause. Oh my God, I had all of them. You see over there. And then I started researching the estrogen level, what Dr. Nova was talking about. I'm right here. My estrogen level was pretty good. And then I looked at this and I'm never going to be able to walk by the time I reach here because my mom can't walk. So this was sort of like, I said, no, I need to start going a little bit more research into what happens, right? I wanted to go into the detail. So I started looking into Indian women and also different ethnic groups of women. Like Dr. Nova talked about, average age is 51, 52. But guess what? For Indian women in India, this research is from Indian women in India, the average age is 46. And early menopause, look at the data here. Almost 12% of the women are getting early menopause. And only 22 women know the cause of menopause. And Dr. Nelva talked a little bit about when you get early menopause, what happens. Then the major symptoms you can see over here, a little bit different between North India and Kerala. Fatigue and hot flashes, she talked about that, cold sweats. Backache is one of a very common symptom for Indian, maybe because of obesity level. And then, of course, you have some emotional crying spell, depression. Jayashree mentioned a little bit about that. And then the sexual level is also, the decreased libido is also one of the reasons. So when I started doing a little bit of research, I found over 35 plus symptoms that are recorded for any woman going through perimenopause, menopause. Then the other interesting thing is that menopause is different as per your ethnic background. For example, Indian women, I just talked about 45, 46, and Caucasian women gets at 51, 52. If you look at the Black American Latino, they're getting it about 47, 48. So now if you start getting earlier menopause, then your symptoms are going to be a little bit more severe. That's what data shows. And your hormone levels are depleting, you're more prone to chronic conditions, like I'm saying here. So chronic condition like memory loss, your mood swings, depression. Depression is very interesting because 50% of us have depression, believe it or not. Heart disease or osteoporosis, more women have that than men. That is like unbelievable, alarming data. Now, the other data is chronic condition. If we don't take care of ourselves during this phase, 80% of us over the age of 55 is going to have chronic condition. So I don't want to scare everyone. What I want to emphasize is the fact, the need for us to take care of ourselves during this phase. The other thing is, I talked a little bit about all the physical part of it. Then there's a whole mental part, right? We don't want to talk about it. The way we show our baby bump, we are so excited when we are giving birth to babies. Now we just want to go hush hush. And that's exactly what I did. When I started getting these embarrassing moments, I did not go talk to HR. I did not go talk to my home, anyone. I was like, oh my God, I'm getting older. I need to start looking, what can I do to continue to look young, right? We have this image, the body shamming image. So this is the data right now. We never want to talk about it. So here comes this, what is it that we can do, right? Dr. Nilva talked about the holistic wellness. So I started researching into the holistic wellness because that's what I had been doing for some other issue that I had earlier. And then I found there's a lot of things that we women can do. For instance, naturopathy, right? Naturopathy, yoga and breathing, food as medicine, Ayurveda. Ayurveda has originated from India 5,000 years back. Counseling, hypnotherapy, traditional Chinese medicine. So when I went around and I talked to around 3,000 plus global holistic experts, now including the medical doctors, integrative medicine doctors, the HRT, like Dr. Nelva was talking about. And then I started talking with naturopathic doctor. For example, there is so much research on how you can incorporate so many things. So I can give examples, Jeshri, if you want.
Sure.
Yeah. Okay, so just give you an example. For example, Ayurveda. Ayurveda has this amazing thing of what they call dinacharya or daily routine. So it's important for all of us to have some daily routine where we incorporate, simple, like, of course, your diet, nutrition comes at the top, your simple yoga breathing exercises. Ayurveda also has amazing massage body therapies. There's a lot of research. I'll give you an example. One question was on the sleeping. There's a therapy called Shirodhara. It's medicated oil on your third chakra that helps with the sleep issues or even insomnia, as an example. Then there are breathing practices that can help you calm down. For example, hot flashes, you do Shitali pranayama, that helps. That's called cooling breath. It helps you calm down. Then there's a B pranayama that helps you with sleeping. So Ayurveda and yoga is amazing. Other thing, Ayurveda has an amazing plethora of herbs. Now don't start growing these herbal garden in your tummy, right? You need to consult with the qualified medical doctor, integrative medicine doctor, but some of the herbs that I can talk about, which has research, is ashwagandha. Ashwagandha has a lot of research with anxiety, depression, sleep, all these things. Shatavari also has a lot of research that has been done. So these are just simple things. Even gut health gets impaired, during that. So there are research on Triphala as an example. So this is a little bit about Ayurveda. Then diet and nutrition is so important. Dr. Nalla was talking about the estrogen going down. There are foods that you can take, the foods that have natural phytoestrogens in your diet, right? The things like your cauliflower, your Brussels sprouts, broccoli, these kind of things. You can start taking it as part of the, weekly routine or whatever you want to do it. Protein is very important. Nutrient density, meaning eating foods that are nutrient dense, is so important for women. Protein in the morning, so it keeps your energy level fine during the whole day. I used to have crazy fluctuation in my blood sugar, and I would want to eat all the time. So if you have a heavy breakfast in the morning, enough protein, and like I said, healthy fats like avocado or some ghee, of course, consult a dietitian, but I'm sharing overall practices, what the research that I looked at and talking to so many holistic experts. Then also there's a research that talks about hypnotherapy can help with hot flashes, believe it or not. Cognitive behavioral therapy can help with hot flashes. Counseling. We don't want to talk about our problems to our family. We think that, especially Indian women, we think that we are super women. We want to excel at everything. Stop doing that. Be kind to yourself. Take care of yourself during this phase. So this is an integrative approach that I am talking about that we women should take, combining the best of what medicine has to offer and taking care of all the holistic therapies, then and making a simple lifestyle modifications, your simple behavior changes that you can do on a daily basis, like Ayurveda talks about. The other thing Ayurveda talks about is ritucharya, meaning eating according to the seasons. Don't start eating watermelon in the winter season, as an example. So that's important. The other thing is cleansing yourself, cleansing your mind, body, at least twice a year. Ayurveda talks about, your spring cleaning and a fall cleanse. So just cleansing your simple cleanse could be a khichdi cleanse that you could do, a mono diet for 3-4 days. So it cleanses your system. It helps your metabolism. So these are just simple things that one can do on a daily basis. Massage is something, Abhyanga is another one that everyone should try to understand. Self massage in the morning. If you can, you take a little bit of a medicated oil. If not, you can take some other oil and massage yourself and feel the difference. Journaling is another one. simple meditation, 2 minutes, that helps a lot. We have a lot of research, talking about efficacy of meditation, efficacy of breath work, me time. Like I
Amita,
said, yes,
sorry to interject.
yeah,
I just wanted to go one slide back. I have a few questions on that, and I'm also kind of watching time.
okay.
So you talk here about power of collaboration for Indian women, right?
Mm-hmm.
You talked about body shaming, you talked about mood swing, depression, some of the symptoms,
Mm-hmm.
and we don't necessarily reach out to each other because we think we are super women, we can deal with it.
Yeah.
This, so talk a little bit about power of collaboration because that also kind of leads us to the women support group, where we would love for women to come together and be part of the support group and help each other. So, based on your research, have you also kind of found out that women don't talk about it, um, not necessarily at work, but outside?
Yeah. So see this. So absolutely, yes, women don't want to talk about it because this topic has been considered a taboo, right? Not only in within the Indian culture, but also all cultures, including. Now,
Mhm.
as we were talking about it earlier, Western women, I think one of the question was Western women do take HRT, and there's a lot of research that has been done in UK, and they're more vocal about it. But
Mhm.
in like I did a lot of research in India, and talking to a lot of nonprofits. And when I started talking to them, they said, "Oh my God, yes, women don't say menopause; they say hypertension. They say something else." But still, there's a taboo. There is a power of community where women can have a safe and inclusive space where they can learn from each other, each other experiences, but also start embracing the simple preventive techniques. So absolutely, the women have to come together support each other. And there's so much research on the power of group therapy.
Mhm.
There's a lot of research done, right? That how the community can, help you. And India is a country full of community. We are all coming from power of community.
Mhm.
So,
So, yeah, so I mean, earlier Dr. Nalva, even though she's a medical doctor, she also kind of promoted or alluded to do some naturopathy, do some non-medical HRT related treatments, or maybe look into the holistic wellness. And you talked about like a whole gamut of things that a woman can adopt.
mhm.
uh, doesn't mean one size fits all. Depending on a woman and her symptoms and the stage and phase of her perimenopause to menopause to postmenopause phase, she can adopt or adapt to some of these recommendations that you have. Have you seen, based on your research, what has helped the most, or is it more of case by case?
So every woman is a different. The menopause journey, like I said, can start at least 7 to 10 years. That's what the research says. So almost for 10 years, you are in this journey of perimenopause. Your hormones are fluctuating, and you can get all kind of different symptoms. So
Mhm.
if you can manage yourself, like I have done self-care, but sometimes self-care doesn't work, then it's better to consult with an integrative medicine doctor who understands naturopathy and can help with your personalized holistic plan, right? So for example, a combination of some of the herbal supplements, the naturopathy that I'm talking about, along with some of the yoga and the breathing work and the changing of your diet. And then the exercise part is very important. You have to increase your weight bearing exercises because it helps with in the bone. We were talking about the osteoporosis and the Ayurveda. I was talking about the massage. So there's not just one thing, Jashri. That's exactly what my point is. It's not a single pill, unfortunately.
Mhm.
Holistic medicine is not like, okay, you take Triphala, you take what XYZ, some herbal supplement, and then I say, start taking it and it's start working. It's a combination of all the different things that you have to incorporate, and preferably in a daily routine. And then if you are not able to cope up, having some herbal supplements that are prescribed to you rather than experimenting yourself,
Mhm.
right? From a naturopathic doctor or who is an integrative and who are extremely knowledgeable about what I am talking about. I'm just talking a little bit of, 2 minutes of what we
Yeah.
should all kind of do.
Yeah.
But there's a lot of data, for behind each and everything that I was talking about. Each and everything that I was talking about, the Shirodhara, the Abhyanga, so many things I talked about, the herbal supplements. It's not just one pill, unfortunately. It's a combination of all these things that can help women navigate this phase of life and beyond with success.
Yeah. So, Amita, we have 1 more minute left. I think you have a closing slide probably.
Mm-hmm.
But in terms of our message from CWC, that's what we want to do: educate all of you, inspire, and then create an impact. And so, all these sessions that you see, what Dr. Nalva talked about, Amita is talking about, we want to create that impact on humanity by educating you, taking health in your hands, and being aware. So, that's our goal. So, anything on the closing?
Yeah, so empowering yourself, right? You are worth it. You are not alone. Together, we can drive the change, we can break barriers and transform lives. And that's what I am trying to do with Nourish Talk, give women this holistic wellness journey using the natural and the preventive wellness, preventive therapies to help yourself. So that's my message, is that you are worth it. And be kind to yourself, self-love, self-worth. That's my final message to all the women.
Thank you, CWC, for the opportunity. So my focus, Amita just touched upon the various holistic modalities. I'm going to be focusing on just one component of this, which is yoga therapy. And again, I emphasize yoga therapy, which is different from your traditional yoga that you would do in a studio or a gym or something like that. So so before we get into the actual yoga part, Jayashree, I want to emphasize what Dr. Nalva and Amita have mentioned. So menopause, every woman goes through it, right? If we live long enough, every woman goes through it. And it's not a disease. So it's a reality of life. I was particularly fascinated. There's one, Barbara Taylor, she called it puberty in reverse. So I thought that was interesting. And I'm not going to dwell too much on this. It's just a recap of what was covered by Dr. Nalva and Amita. Menstrual period, we all know that if after the last period, when you finish a year, that's when you're officially in menopause. And it's accompanied by depleted estrogen levels. And again, just to emphasize, it's a normal natural life event, and it is, a transition phase. The one point I wanted to make is menopause can be natural or it can be induced. I think Dr. Nalva touched upon it a little bit. Chemically induced, for example, if you're going through cancer treatment, chemotherapy, or it could be surgically induced. For example, if you have your ovaries removed, hysterectomy, etc. And then this is just a recap of all the symptoms that we talked about. Physical, hot flashes, we talked about sleep problems, mood changes, mood swings, right? And all the other thinning hair, all par for the course. And again, stages, Amita touched upon this. I don't want to dwell too much on this. The only point I wanted to mention here is, can you see this okay? So the postmenopause, once we are officially in that menopause, then postmenopause is something that stays with us for the rest of our lives. And so some of things that we need to be aware of, and again, all this is not new. So osteoporosis, bone loss, so that is something we can pay attention to. We already touched upon urinary problems, cardiovascular diseases. These things, the risk of these events increase as, along with the aging process, it's more, it could increase during the post-menopause stage. So putting all this together, the point that I wanted to make here is the symptoms of menopause spans, all layers of our being. So we have all the physical symptoms that we've already talked about: hot flashes, headaches, weight gain, right? I mean, we may find little belly fat, weight gain, joint issues, aches and pains, some weakness in muscles. Then we touched upon sleep issues quite a bit, right? So which again could be related to the lack of energy, fatigue, tiredness, and then stress, anxiety. So stress is an underlying cause for many things: anxiety, fear, anger, and then all these negative thoughts and other things. So it pretty much affects all layers of our being and how we present ourselves to the external world. We touched upon relationships, families, so how we show up in the world, right? So and this is where the yoga fits in,
So
because
Vidya, I'm going to just ask a question here or also
Sure.
mention something. So the attendees on this call, some of them probably might be in the perimenopause or menopause or might not have embarked on that journey. So this is a very good information for them, what they would encounter. As their stages and phases move, what are the things that they can encounter and be aware of it in advance rather than kind of getting shocked or feeling, oh, what is happening to me?
Yeah.
If you can maybe spend a minute or 30 seconds on how to ensure that we be prepared for that journey.
So one is, right, awareness. The first step is awareness. And I can share a personal story. In my case, my menopause was chemically induced. Okay, so due to medical treatment. And it caught me unawares. So I was menopausal, and it caught me unawares, despite my pharmaceutical background and everything, right? So it caught me unawares. So suddenly you start waking up and think, I'm not old enough, to be having all these aches and pains. What's going on with me, So, and then slowly you start. This is along the lines of what Amita was sharing. I didn't have all the hot flash issues. For me, it was more joint issues, aches and pains. I would get out of bed and think, I don't even feel refreshed. I'm sounding like my mother, like with all these aches and pains. So then that's where I had to go, okay, so is this related, to menopause? Is it because of the treatment that I was going through? So then you start getting into it and you start exploring, medication, like it's an option. But before I go into medication, can I, try something? Can I look at my lifestyle? What is it that I need to change? Can I start doing some weight bearing exercises? Should I work? And a lot of us, right, Indian women, core strength is a problem. So, back keeps getting thrown out, or, leg pain, hip pain. So then can I start doing some weight bearing exercises? Can I start, like strengthening my core? So these are some of, the proactive measures. And then can I look at, my lifestyle? How's my stress level? How am I eating? Right? So then this is how I started. So just taking a look. One is the awareness, one is noticing all these changes. So instead of it coming and attacking you right away, so then this kind of education, these kind of sessions we are having here through CWC, educational sessions, awareness. So the very first step is awareness.
Yeah. I also
Recognizing
noticed,
what to expect.
right. I also noticed, for example, on your chart, the right side where we talk about the weight gain, loss of fitness, weak muscle, and joint issues, and then the sleep issues. Those two kind of are the kind of immediate ones that hit during perimenopause. And I have seen that leads to more of stress, anxiety, and depression, which is the next phase. Because a woman suddenly feels, oh, no matter what I do, no matter how much less I eat, my weight is just not reducing. The bump that we would, or the baby bump that we would very proudly flash, has a different bump now, and it just wouldn't go. No matter how much you exercise, you just feel sore and tired, and that then leads to the feeling that what's happening? Am I now becoming or sounding like my mom? Am I aging? What's coming? Because you were up until then youthful, you were energetic, active, and suddenly there's a twist or a curveball thrown at you.
Right.
So to be aware and then to deal with it, because now I think health is in your hand and you need to deal with it. So
Right.
just wanted.
acceptance too, right?
Acceptance.
So one other thing, right? So this doesn't have to go in this one, it's not like just in this clockwise order. Sometimes it could just start with stress, anxiety, fear, right? I mean, so it could be top down or bottom up, as so to speak.
Yeah.
So and they all mutually feed each other.
Mhm.
So increase in stress can affect your sleep. Lack of sleep can affect stress and anxiety, right? So they all mutually feed each other. They're food for each other. So, and here, this is why I'm so passionate about yoga, and that's what got me. I mean, so during my journey, my focus was, in addition to some Ayurvedic intervention, my focus was on the yoga, and that's why I went ahead and did my master's in yoga therapy. So the reason yoga fits so well is yoga is this holistic approach. It doesn't view us as just our body or mind, right? It gives you this holistic perspective. And so, according to yoga philosophy, um, we are a multidimensional being, and it talks about 5 layers that are interconnected, and starting from the gross to the subtle, so increasing level of subtlety. So, gross body. In the yoga therapeutic framework, it is called Annamaya Kosha. Then the next, right, the breath is just the external manifestation, but there is something called prana or life force. And this is where all our sleep issues, energy, fatigue, according to the yoga framework, that is where it is classified. And that's called the pranamaya kosha. All our moods, emotions, that is in the realm of mind and manas, and that's called the manomaya kosha. And then the higher intelligence or the higher cognitive aspect of our system, right, which makes us reflect, process things. So that is called Vijnana, is wisdom. And in the yoga therapeutic framework, it is called the Vijnanamaya Kosha. And ultimately, this sense of connection, the sense of joy and peace and expansion. So that is what is called the bliss body. It's not the hedonistic pleasures per se, right? Happiness that you would get with a new car and things. It's more about this inner bliss, awe, etc. So that is something, and that is what yoga calls Anandamaya Kosha. Okay, the sense of flourishing and vitality. Sometimes, and one point I want to make there is sometimes, even despite all our external pain and everything else we are going through, it doesn't have to affect our inner sense of peace and calm and equanimity and flourishing, the sense of flourishing. So that's something that that's the other thing that yoga teaches us, to kind of know that we are different from our pain and whatever else that we are going through. So that's the framework, yoga therapeutic framework. And I just put this here in psychology. There is something called the biopsychosocial and sometimes biopsychosocial spiritual framework. So there also, the point is that we are not just our external bodies, right? We have, it spans multiple dimensions of our being. And so with that yoga therapeutic framework, now if you take the menopausal symptoms, right, it nicely fits into these 5 dimensions or 5 layers that is given by the yoga therapy framework. If you look at all the physical symptoms, the vasomotor, like hot flashes and so on, physical functioning, joint issues, the urogenital issues. So that's all in the realm of the physiological aspects or the Annamaya Kosha. And so yoga has tools for addressing that at the physical body level. Then sleep and energy. So there are practices like yoga nidra and pranayama that can be used for all these sleep and energy aspects, right? So there are tools there. For the mind level, again, for the psychological aspects, again, yoga therapy has tools like meditation, mindfulness, mantra chanting. And then for the Anandamaya, so yoga also helps with building this equanimity and coping skills, coping strategies, knowing that I'm different from what my body is going through. So those kind of tools are also provided by yoga therapy. And so if you get into specifically, we spoke about hot flashes and mood swings. Stress is an underlying factor. So There's a lot of scientific evidence that shows yoga is beneficial for stress management. Weight-bearing postures. I mean, you do sun salutations, planks, or the warrior poses. So these are all weight-bearing postures and with, isometric, strength building. So that is, again, good for bone strength. With muscle loss and balance, there are a lot of balancing postures that are available in the whole gamut of yoga postures. So there again, one can use for balance, for building balance and reducing the risk of falls. Cardiovascular, again, lowering of stress is a big component. So there is a lot of evidence that shows yoga practices along with breathing mindfulness, etc., can lower cholesterol and blood pressure and so on. And most importantly, once you get into the practice of yoga, it teaches positive qualities for acceptance, equanimity, sense of gratitude. And, so that way we start paying attention to any of the self-defeating and the stories we tell ourselves, self-defeating attitudes. Oh, I'm getting old, or my hair is so how I look is dependent on how much hair I have on my head or, my little belly fat or something. No, I mean, it teaches us, okay, so this is the reality. I'm doing what I can, but this is the reality. And let me just, accept what is happening. So it teaches us those skills. There's a lot of published scientific evidence, particularly the impact of yoga on physical symptoms. There are publications related to that. Then psychological symptoms, most importantly, no side effects. And I mentioned the coping strategies for just dealing with these symptoms. So here are some detailed publications. I won't go into that, but there was an 8-week study that showed benefit on this kind of climacteric is this transitional phase. Anything associated with the transition, then the perceived stress. So there was a benefit there. There were studies, it was a 4-month study that showed improvement in sleep symptoms, insomnia, and other menopausal symptoms. And then another study that showed benefit on the vasomotor symptoms. These are the hot flashes and quality of life, and specifically a study done on the coping strategy. So, so that's all I had in terms of my formal presentation. So open to questions, and maybe we could just do a quick, this was longer practice, but I can do a shorter practice because this, so Jayashree, I'll let you decide how we want to proceed. Yeah.
Sure. I think let's end it with that smaller practice.
So it's a simple hand gesture practice, and all we are going to do is like a globe. We are going to bring our fingertips touching each other, and then just place it resting on your lap in front of your abdomen. Then sitting comfortably on your chair as you hold this mudra. So this is called, it has a name, it's a hand gesture or a mudra. It is called Hakini mudra. So as you hold this mudra, releasing any tension and stress from your neck and shoulders, keeping the spine erect. And as you hold this gesture, bringing your awareness to the breath, take a few natural breaths and notice the sensations and feelings evoked by holding this gesture. And notice how each inhaling breath flows upward from the base of your body to your collarbones, and how each exhalation smoothly descends, feeling the sense of relaxation and release. Continue to take several breaths, noticing sensations and changes that happen as you continue inhaling and exhaling. So notice a feeling of integration developing as you continue to hold this gesture and bring your awareness to the inhalation and exhalation. And whenever you feel complete, gently release the hand gesture and take a quick look at feelings in the body and the breath. Thank you. And the beauty is, even if you're at work, wherever you are, you can stick it under the table, under your, chair, and then just do this, right, throughout the day. So, yes.